All right, Dr. Emer, we're live again in New York.
Hey guys, we are now doing a combination for facial rejuvenation, BBL Hero with Fraxel. BBL Hero is one of the newest light treatments. This is going to help not only redness, but also get rid of a lot of brown spots. She has broken capillaries. We want to improve the overall texture of her skin and color. This also will help, honestly, with any bruising that she would have post-filler. And so we're doing that on the full area. This wavelength helps color, helps overall rejuvenation, just overall like improves the quality of her skin. And you guys can see how fast it is. In the old days, we used to have to do, so that's it for that wavelength. Hold on. I'll switch here a second. How was the pain on that?
It's fine.
Minimal.
Mm-hmm.
Good. So now we're going to go to the one that you may feel a little bit more. So this one targets some of the capillaries and some of more of the browns, which is what I really want for her because I want her texture and color of her skin to improve. And so we're using a gel. So again, she may feel this a little bit more. You guys see how we're really covering the full treatment area, really rejuvenating the area. We're gonna go really close up into the eye. There we go. She's completely safe. And we're really just targeting superficial pigmentation, capillaries, and any broken capillaries or any staining. Like if someone got a bruise, significant bruising, and it caused pigment, this will really help that pigment. And so we're literally focusing on that with this wavelength.
What kind of laser is that?
So you guys, this is BBL Hero. This is the newest, fastest, most powerful light treatment on the market. It can be used for pigmentation. It can be used for anti-aging.
Why this over Excel V? Excel 5?
Because I actually was going to originally do that for her. But because this is so much broad, I can get a lot more out of it for her, including the vessels and the redness and the pigmentation. So that's perfect. So that's all we really needed to do. Now, one thing I'll show you that's really cool is we can take this little baby add-on, which I'm going to do right now. Hold on one second.
For those of you joining us from earlier, this is our patient that just did facial sculpting. And thank you for coming back to watch us again.
So now what I'm going to do,
So how much for this? You guys, every treatment is different. If you do need to consult with us, send us your full name, email, and phone number, and we'd love to reach out to you.
a second. So she has really dark pigment under her eye. So I'm going to take our small baby adapter, and I'm actually going to go right up in here. Keep your eyes closed, and we're just going to pulse lightly. We want to get this pigment, okay? As long as her eyes are covered and closed, we're safe. We can go right up here. Perfect. We're going to do that same thing underneath here, and then we're going to do on top with laser. So again, we're going right to the under part of her eye. Okay, hold on. Trying to get the lashes out of the way. Pulling down on the eye. Perfect. And so now we got all the under eye. So now what we're going to do is we are going to clean her off. It's going to get really dry. Again, more alcohol. I'm sorry. One more time. We got to get this gel. And now we're going to start Fraxel. Now there's other options for lasers. Hold on. There's other options for lasers like Halo and other treatments. My focus with her, she had a burn basically and some bruising. And my focus for her is on a lot of pigmentation, so I actually want to focus on this with a 1927 wavelength, which is different than Halo. I love Halo, but it's 1470 and 2940, so it's a different wavelength. And I want to focus on really pulling up pigment from her. So that's why we're not using Halo right now. But look at all this brown. See how it was literally pulled to the surface? You could see the browns all pulled to the surface, and her redness actually is subsided a little bit. So now we're gonna go to Fraxel. So we're just gonna cover her lightly. The great thing with Fraxel is your eyes are really well protected just from that in general. So we pre-treated with our vascular laser. And now we're going to our resurfacing. So again, how does it feel? Are you okay? She's really strong. So we're focusing on the surface. This is a 1927 wavelength. And this focuses on the surface. This is a thulium laser. It's gonna get rid of sun damage, but it's also gonna get rid of any hemosiderin, meaning like any pigment deposit on the skin or any staining from bruising or trauma. It's gonna improve the quality of her skin. And the biggest thing, you guys, we always treat the face and neck because that allows us to get more rejuvenation. You don't want to look really young on your face and not have anything happening to your neck and chest. What are they saying?
Hi, Doc. What's going on and what's the name of this surgery?
So we initially did BBL Hero. Now we're doing resurfacing, and BBL was for our vascular redness, our brown, any sun damage, capillaries. We actually worked on the dark circles. And now we're working on resurfacing. We want to pull up the sunspots. We want to keep her looking young. Honestly, she's just going to look so much better after this treatment. She's doing really good. Got lots of cold air. She's a champ. Honestly, put her through a lot today with the facial sculpting. And this treatment, you guys, I do this every 3 or 4 months. This is something you should be doing regularly on your skin. We're not going crazy aggressive, but this is 45% coverage, which means that it'll take her about 3 to 5 days of some light peeling. Glass pass.
And I know someone's asking, what is her downtime like?
We just said 3 to 5 days. Within a week, she's gonna look great.
Will this fix broken blood vessels?
Say that again?
Will this fix broken blood vessels?
Yes, actually our treatment will. The combination of the BBL with the Fraxel will definitely do that. And now we're gonna go up here. Now look at all the brown spots that popped up, you guys. You can see all of them were lifted from the BBL. I'm really excited about that. That means that a lot of that is gonna clear when we do our Fraxel, which is now, because it's targeting those enhanced brown spots. When we do multiple passes, this will help scars, this will help pigment. She's also following a very strict skincare protocol. And that's why she was a little red before coming in. But I'm just glad that she did because it made a big difference already. Just crazy how much damage she had. But look at this. I mean, she's doing amazing. What else are they saying there?
Can this treatment be done on darker skin tones? Does it cause more discoloration?
It depends. We have to see you. Fraxel is made for every skin type. but in different settings. So this may not be, now the BBL may not be able to be. Now I'm gonna go onto her neck, so we finish that other side. Finish this full side. Some people respond a little better to this than others, but in general, this can be used on almost every skin type. And you see we're going through the full neck, all the way around. I want to get any sun damage she has. What else are they saying?
Someone asked, does Dr. Jason have celebrity clients? I don't know, and we cannot disclose names.
The answer is yes, we have many, but I can't tell you who, except for people that have promoted me. So I could tell you, even recently, Kirsten Maldonado just did our Aerify kit. She's one of the lead singers for a group that you guys know, Pentatonics. And I have a lot of other celebrities that have done treatments on our YouTube that we've talked about, including Catherine Bell from The Good Witch. You guys should watch that show. It's an amazing show. She's done Morpheus treatments before. Holly Saunders from Golf Channel, and she's a famous model now. All of them have done treatments before. Summer Rae, frequently doing my skincare line and my peels. Turn this way. These are all people that have promoted coming to our office. And then you guys know also I posted a picture last year, myself and Sofia Vergara. A good friend of mine, really sweet. So we keep it pretty secretive. My clients like to be chill. I'm the secret weapon of Beverly Hills and Hollywood, in my opinion, because I'm from the Midwest. And I love being loyal and honest and not taking advantage of people. So we only do what's needed and what's honest. You guys can see there's little baby holes that are being created in the skin. And this is heat that will help resurface.
So what type of laser? This is a Fraxel, guys.
Yeah, this is Fraxel. It's a thulium 1927 that we're working on right now. Remember, it has two wavelengths. Also a 1550 nanometer, which is an erbium. So
someone had very bad laser surgery, burnt their skin so bad they've been suffering for the last 2 months.
who did?
One of our viewers.
From me?
No, somewhere else.
Oh my God! Come see us then. I feel really bad.
We can help you.
I've never had a client that had that before, so that's why I was like a little shocked. But yeah, please come see us. I mean, some of my patients will get hyperpigmentation that we know will happen. Frequently, some of my sensitive skin types with CO2, with deep CO2. We were talking about that today. But that improves with just peels. And we can get rid of that very quickly.
Yes, we are very good with helping people who've gotten bad treatment somewhere else, whether it's been laser or even surgical too. We do a lot of revisions.
That's my goal. Helping people that have been injured. All right, last pass here. My patient here right now has had some pigmentation issues and some other traumas in the past. We're working on improving that as well for her. I always tell people it's best we want to move forward. You don't want to take a step back. So you just do what you can. Perfect. So again.
Okay. Tell your client I said hi, that's my cousin.
Your cousin? She's what? Is it he or she?
There's a she.
If she's watching? Oh, cute. Your cousin's watching. Is it Diana?
Danielle Rose.
Her sister.
Oh, cool. Say hi.
Twins.
Hey, guys. She's doing amazing. She looks amazing. Look at that profile. And look at the laser. We're doing really good. That's so cute. That's so funny. Your whole family's watching. I love that. See, that's what I'm talking about. A Midwest guy. Loving the family. Late night here.
Is it right to say that laser is nothing compared to a fully ablative CO2 laser in terms of effectiveness?
Oh yeah, totally different. This is non-ablative. CO2 is fully ablative or fractional, and totally different. Ablative versus non-ablative, you can't compare. Can't compare. You'd have to do many of these treatments to get close. But we're not looking to do that aggressive on her.
Can you fix an asymmetrical face using fillers?
Usually you can, but again, it's all about expectations. Some people need more. You know, so you might need maxillofacial surgery or implants.
And for that, you would need to consult with us. You can do that by sending us a DM with your full name, email, and phone number, or email us appointments@jasonemermd.com. How come you aren't using your metallic eye covers?
We don't need them necessarily for the Fraxel. We can have them, but it's not necessary. We're just using a little eye stickers today. It's easier. But we do love our metallic eye shields from Innovative Optics. You guys know I helped Innovative Optics make new eye goggles. So if you're looking for goggles, definitely go to Innovative Optics. They're amazing. She's doing amazing. You're basically done. How is it? Are you okay?
I'm good, yeah.
It's painful, but she's doing great, you guys. Tell her cousin I'm trying not to torture her too much.
Love her.
She loves you. She loves you. So I always go up to the ear as well. Sorry, make sure to go fully to the ear. And she's just gonna shed lightly. She'll bronze a little bit tomorrow and the next day. Then she'll shed the next couple days. And last pass.
Yes, that little bit of blood you do see, we did fillers earlier. For those of you asking, that's where it's from.
Yeah, and she's also has a couple bruises, one little spot here, nothing crazy. And now what I'm going to do, same thing we did before. Bring the eye shield a little higher, I'm going to go right under the eye. Let's do a couple passes right under there, because that's going to get rid of a lot of pigmentation. Same thing, any dark circles. Go right under there. Totally safe. She did it. So now I'm going to give her, that's it you guys, I'm going to put some PRP on, but I'm going to give her, go ahead and hold this tube now in the other hand, blow that on your face, okay? Now what I'm going to do, you can stay on there. She's going to keep cooling. I'm going to take these off. Everything did great. And what we're going to do is I'm going to apply a little bit of a hyaluronic acid gel because her skin's going to feel very sandpapery right now all over. You guys can kind of see it. The texture of the skin being a little sandpapery. You see that? Like right there, very dry looking. So you want to place this on. Get it real moist. She's got the cool air, which really helps, I think, a lot. Any of the gel gets in your mouth, it's okay. It's just water, it's hyaluronic. And then I put a little bit of my PRP. So I'm going to place the PRP on the skin. This is going to help her heal. Remember, this is growth factors from her own blood that we took out. She has a little extra here because we had a little oopsie with the PRP tube. So she gets some extra. She can take some home later tonight too. And it's going to help her heal. And then I'm going to microneedle just lightly on her skin. She's gonna look so good in like a week. She's gonna look amazing. So again, perfect. And then we're gonna use Skinpen, you guys. You guys know how much I love Skinpen. We are gonna do just a light microneedle. You're gonna feel this a little, okay? And my goal is really not to be crazy with the blood here. She'll have a little bit, I'll show you guys, but not that much. Just a little bit, pinpoint, see? That's all we need. See the pinpoint? That's perfect. That's exactly what we want. And that's gonna push all the PRP in. We're just gonna do it lightly under the eye, lightly right above on the bone. Tighten the eye for her, why not? Get a little bit extra out of it. Doing so good. So this is a great combination after the fillers. BBL, Fraxel, Skinpen, PRP. It's gonna heal a lot better. You can see a little bit of bleeding here, nothing crazy on the brow, but I want her to get some improvement in tightening her upper lids. And then we do a little on the neck. Can't forget the neck, you guys, just like I said. Gotta keep it young and healthy too. We're going all the way up. Tightening on the jawline. Great. That's it. So take a look. We can do a quick pan. Is it much cooler with the air?
Yeah.
Good. I think the air really helps. And then that's it, you guys. I'm just gonna apply. I want to apply a little bit more hyaluronic acid. We're also gonna put on Emer Skin products, AOC, Hyla B, Refit Face, and then that's it. Then she's gonna go home and heal. Just want to keep it really moist, and she'll heal over the next few days. Maybe she'll send Jordan some pictures every day. Why not? And we'll follow how she's doing. She'll look great in a week. Alright, you guys, so that's it. That is female rejuvenation, facial rejuvenation, combination, vampire facial, PRP, BBL Hero, and Fraxel. Bye, guys. She's waving. Okay, keep cooling for 5 minutes, okay? She's done. Yep, perfect time.